Our healthcare system is broken because today we don't handle patient information effectively. Patient data comes from multiple stakeholders who have no easy way of accessing it and sharing it. Today, the patient is often the middleman, the go-between who has to find and offer his medical information to the many doctors, clinicians, and healthcare organizations that need it. As a result, getting even the most basic of healthcare services is full of inconveniences, delays, redundancies, administrative hassles, and financial surprises. Meet Linda. Linda is Bobby's mom. Bobby is 9 months old. It is midnight. Bobby has had a fever of 103 and has been crying inconsolably for 3 hours. Linda calls her pediatrician's answering service. The service assistant asks Linda a series of questions. The service assistant says she will alert the doctor on call. The doctor on call calls Linda back. This doctor is not Bobby's pediatrician. She practices in the same medical office but has no access to Bobby's medical history or current condition. The doctor asks Linda a series of questions about Bobby and his condition, many of which she already provided to the answering service. The doctor says Linda can go to the ER or she can wait for the office to open. Linda rushes off to the emergency room. She's greeted by a person at the receiving desk who asks her the same questions she's already been asked, and then tells her that someone will be with her momentarily. Linda and Bobby go into the waiting room. Finally, Linda and Bobby are shown into an ER exam room. Linda is greeted by the emergency room nurse who asks her the same questions again. Linda is desperate. It is 2 a.m. Dr. Jones, the emergency pediatrician, finally comes in. The nurse did not brief Dr. Jones, so he asks Linda the same questions about Bobby's medical history. At last, Dr. Jones diagnoses Bobby with a severe ear infection. Dr. Jones asks more questions. Dr. Jones writes a prescription. It is almost 3 a.m. now. Linda drives quickly to the nearest 24-hour pharmacy. Linda presents the paper prescription to the pharmacist. Oh no! The ER pediatrician accidentally prescribed tablets, but baby Bobby can only take liquids. Now the pharmacist has to call the emergency pediatrician to see if they can get the right prescription. The pharmacy gets the right prescription, fills it, and rings up the medication for Linda. Alas, the pharmacy has outdated insurance information on file for Bobby. Linda must dig through her purse to find the new insurance card. Ta-da! Linda finds her insurance card. The pharmacist tells Linda she needs to pay $100 for the medication. Turns out her insurance benefits changed, and now Linda needs to pay for a bigger portion of her medical expenses out of her own pocket. The next day, at the recommendation of the ER doctor, Linda takes Bobby to his regular pediatrician, Dr. Smith. Dr. Smith proceeds to ask her everything that happened the previous day because she does not have access to any of the information about Bobby's ER visit. We and our healthcare providers are in a medical data vacuum. Our healthcare system is broken because it's nearly impossible for us and our doctors to gather up all the patient medical data from all the people and organizations that hold it. Your PCP and specialists have a hard time even getting basic medical history information to or from one another. Today, your doctor doesn't have a full picture of you. But what if she did? And what if taking care of your health was actually hassle-free? What if Linda could connect with her pediatrician online? What if the pediatrician could instantly access Bobby's medical history, immunization records, past prescriptions, insurance information, and offer Linda advice and referrals based on that full information? And diagnose Bobby using a webcam right there on the spot without Linda and Bobby having to ever leave the house? Here, Linda, I see that your insurance covers the following antibiotics, but one has a higher copay. Both options are equally effective, so why don't you save some money and go with this one? What if she could also immediately provide some guidance for future care? I also see this as Bobby's 3rd ear infection in 4 months. I'm emailing you some tips on how to deal with ear infections based on recent medical research and industry-accepted best practices. I'd also like you to come in and see me. I have our schedule right here in front of me. Let me see what is available. And help you get an appointment quickly with an additional physician. Your insurance requires a referral. Here are 2 choices for specialists covered by your insurance plan, both of who are within 10 miles of your home. Great. Dr. McNeil it is. Let me send in that referral for you. First, I need you to sign this release form, which allows me to share Bobby's medical record with Dr. McNeil. Once you review it, please click here to allow the release of information. Yup, that easy. No, Linda, you don't need to bring anything to that appointment. Bobby's complete medical files will be safely transferred to Dr. McNeil before you visit her. In a time when so much of critical data about us is electronically connected, how come our health data and our healthcare system are not? What if your doctor could easily access all the medically related, clinical, administrative, and financial information about you from one single secure place? What if all your care providers could easily and securely access that information? What if we know what our health insurance coverage is, when we need it most, and before we get treated and receive a surprise bill? What if next time we go to the ER, everybody knows our medical history and insurance details so we can get the care we need right away? We, the patients, have the right to have our medical information managed in a unified, connected, and secure way. Ask your doctors if they are using technology to manage your medical information and patient care. Ask your doctors if they feel they are using technology that gives them a truly holistic picture of your health. The future is here. It is patient-centric and unified. Unified Patient Information Management brings together separate pieces of healthcare-related information in one place to present a singular view of the patient. For you, the patient, this means fewer hassles, less paperwork, better care, and more tools that empower you to better manage your own care. For your doctors, it's easy for them to manage their businesses so they can spend more time focusing on patient care. UPIM, healthcare is about to get a whole lot better.